Good, good. Good morning, everyone. Don't you have to stop eating? Keep on enjoying your breakfast. But my name is Hunt Fitzgerald. I am the chairman of the board of Roxborough Area Chamber of Commerce, and I'm here today to kick off a Good Morning Coffee Hour sponsored by Roots and Wings, the Department of Social Services and Healthy Personalians. So in just a few moments, we're going to look forward to their message. But right now, we're delighted to have Alicia back, and she's going to share some announcements with us. And I'm glad, because I did a terrible job last month impersonating her.
Sounds like I need to watch the video on WKRX there and see how you did. Good morning, everyone. It's wonderful to see this huge crowd here. It's a good problem to have when we have to pull tables from the other side of the building. So thank you for your support this morning. You have got a lot of paperwork at your place, so I'm going to run through it really fast. One thing that's not in front of you is that we are hosting soft skills for teens in the month of October. We're going to be at Person High School, Person Early College, at Roxborough Community School on October 12th, 13th, and 17th in the mornings. If you are someone or you know someone that would be able to add to this program and talk to students about how to dress, how to speak, the do's and don'ts of being a good employee, we want to give these students some good tips for when they go out and are trying to get their first job, or maybe they have their first job and we can help them take their employee skills to the next level. So if you've got any questions about that, give us a call at the chamber. We'll fill you in. But the career fair is something you do have in front of you, set for November 8th. This is a joint project of the Chamber's Education Committee, Person High School, and Roxborough Community School. It is a great program where we gather all of the county's 12th graders together and expose them to some career fields that maybe they don't know about. I know it's really easy for us to go, I want to be a doctor, I want to be a lawyer. But as everyone in this room knows, there are hundreds and hundreds of other job opportunities and career tracks that we hope we can expose these students to, especially opportunities right here in Person County. So again, if you know someone that you think would be a good addition to that project, let us know. We'd love to have the participation. You've got a flyer for Bingo, our annual event with Joe Weinberger for November 2nd at Roxborough Country Club. Last year, we had more than $6,000 in prizes for those games. It was a really big night. Joe hooks us up with designer handbags and flat screen televisions and all kinds of fun stuff. So we'd love for you to join us, and if you can't join us, we'd love for you to donate something. Last but not least, you've got some paperwork in front of you for an event at the museum later this month on September 29th. This is not officially a chamber project, but I'm on the planning committee. It is a project near and dear to my heart. It will be the largest celebration commemorating Person County's 225th anniversary. So we hope that you will look through the flyers there, think about whether or not you're able to join us, or maybe you can support the event by being a time capsule sponsor, or donating a bottle of wine for the wine pull, or being just a general sponsor for the event. Again, any of those materials you've got, if you've got questions, I'll be up front later and be happy to answer any questions for you. Relay for Life, right? I didn't forget. Is this Friday at Person High School. Raise your hand if you know you're going to be a part of the event on Friday night. All right, we need to see more hands up, so make sure you add that to your calendar. And if you've got any questions, Ronnie's your man after the program. Michelle's your lady after the program. All right, I think that's all the announcements I've got. I'm going to pass it back to Hunt. Thank you again for being here.
I get this thing we're speaking to it now. I'm going to recognize a few elected and notable officials with us today. We have Vice Chairman, Person County Board of Commissioners, Gordon Powell. Hey, Gordon. We have Jimmy Clayton with us this morning. He's over hiding behind the glass. And Ray Jeffers. Hey, Ray. Sheriff Dewey Jones. I didn't skip you this time. Register of Deeds, Tanya Wilson. Margaret Bratcher, Chairman, Board of Education. Mark Galloway, Judge Mark Galloway. Judge. Police Chief Hess. And we have our newest school superintendent, Dr. Rodney Peterson. And I think Marilyn Newell want to go up and speak for a second in regards to getting the vote out.
Yes, thank you.
Thank you and good morning. I appreciate the opportunity that Hunt has afforded me to talk with all of you about the municipal election coming up. We start early voting next Thursday, September 21st, at the Board of Election office. That's going to be daily from 8:30 until 5 p.m. during the week, and then on Saturday, October 7th, from 8:30 to 1 p.m. That's the only Saturday that will be included in early voting. Our election day is on October 10th. That is Tuesday after Columbus Day. And the venue has changed for the city election this year. We will not be voting at City Hall any longer. This time it's now going to be at the Person County Office Building Auditorium. So please remind all of your city resident friends to come out and vote in the municipal election. I know Hunt is going to introduce all of the other elected officials and candidates who are here today, but before he does that, I'd like for all of them to stand. If everybody that's running for the municipal election would please stand. Okay, and Hunt will introduce these fellas in just a moment. Thank you so much.
All right, thank you for that message to get the vote out. I know midterm elections are a tough time to get the vote. And I did skip over the whole city elected staff. And we had, of course, Mayor Bill Newell with us, Henry Daniel, and Mark Phillips. And so these guys are also running for re-election. Reggie Horton, I'm sorry, Reggie. Don't hold me against that.
Everybody forgets about that.
So these guys are running for re-election, so make sure if you live in the city limits, get out and vote. So now I think we've got Gordon Powell is going to introduce today's speaker. He's going to make his way up here. Get the program started.
Thank you, Hunt. And good morning, everyone. What a crowd we have here today, and it's so good to see this good turnout for the program that we have today. Today, of course, the topic is substance abuse prevention, and I have the pleasure of introducing our speaker for today. But on behalf of the Person County Board of County Commissioners, I do welcome each of you here today because you are an integral part of what goes on in Person County, and thank you so much for your support. I want just a word or two before we do introduce the speaker. This subject today is one that we probably don't want to talk about a lot, probably don't talk about enough, and one that we probably think of as being a problem somewhere else. But when I pick up a major newspaper a couple of weeks ago and it's about opioids, then I pick up the National County Commissioners County News. There's an article about opioids. And I pick up something maybe a little more nearer to us, or me in particular, the Kiwanis magazine from last month. It's about opioids. And we think about those problems being somewhere else. Folks, some of you I don't need to remind, but it's a problem we need to be aware of. And when we look at numbers and data from Person County, I think it's alarming. I'll just read one or two to you. Person County has the 8th highest opioid prescriptions per resident of 100 counties. Is that something to be proud of? Absolutely not. The statewide average is 1.06. Person has 103 opioid pills per resident. Again, and this one ranking us at 18th out of the 100 counties. It's not something that we want to be proud of, but something we need to focus on and actually get involved and do something about. So, and I won't get into anything else with that, just want to quote some numbers to you as a reminder. But we have a very qualified speaker here today, and it's a pleasure to introduce to you Kendall Wood. Kendall earned a bachelor's degree in community health from the University of Maryland, College Park in fall 2013. After graduating, she started working at MedStar St. Mary's Hospital as a community health educator for several months, then was offered the position as program coordinator for the Strategic Prevention Framework grant on alcohol prevention. She worked on underage and binge drinking initiatives in St. Mary's County, Maryland for 2 years. During this time, she gained experience in coalition work, building community capacity, and mobilizing her community to combat substance use. Also during those 2 years, she started working on the opioid misuse prevention program, a grant to help reduce the misuse and abuse of prescription drugs and reduce the overdose-related deaths in St. Mary's County. She also worked in helping to prevent overdose deaths related to heroin by educating and training law enforcement and community members on the proper use of naloxone? Naloxone? Yeah, it's a new word for me. But it's a great pleasure to introduce to you Kendall Wood, who's driven up from Raleigh this morning to be with us here in Person Kansas. So let's give Kendall a nice, warm coffee hour welcome this morning.
Can everyone hear me okay? I might have to hold it. Thank you for having me today. It's great to see so many different faces here. It's hard to get everyone in the room usually sometimes. But I previously worked on the Partnership for Success grant as the outreach specialist, and that was 13 counties within North Carolina. And right now, I'm the SPIF RX program manager, which is Strategic Prevention Framework for Prescription Drugs for North Carolina. And right now, that covers 5 counties, which are actually very rural counties, similar to Persons County. And that's just to help reduce prescription drug abuse among youth 12 to 17 and adults 18 and older. So just let me know if you can't hear me. I'm not used to holding a mic all the time. But I just want to kind of get started. I only have about 30 minutes. I'm going to leave some time for questions for you guys. So I don't know who's keeping track, but just let me know if I'm running a little behind and I'll speed up. Okay. So right now I just kind of wanted to give like an overview of what North Carolina in general is doing around prevention. You know, opioids is across the country a big thing. There's a lot of money out there to help reduce this problem. So North Carolina just received the Big Cures funding, STR grant, which is to help prescription drug misuse and abuse in high need communities. And I think that's about 14 counties that received that funding. It's for 2 years and it's millions of dollars, which is also prevention and treatment that's going into our state. Right, and then with that grant, it's helping expand the Lock Your Meds campaign, which I don't know if any of you heard of that campaign. No? Did any of you guys go to the prescription drug overdose prevention statewide conference in Raleigh in June this year? Just a couple of you? Okay, so at that conference we showcased the Lock Your Meds campaign. It's really based out of Florida, but it's to help with expanding and focusing proper storage and safe disposal of your unused or expired medications. And it's really for parents and guardians of youth to try and deter them from stealing your medications within the household. So and there's resources available if you would like them. I can contact you with that person. You know, with the funding, we're able to provide these materials for the next 2 years to any county or community organization throughout North Carolina. And the SPIF RX grant also that I'm working on helps expand this statewide campaign. But I tried to give a little bit of overview of all prevention because, you know, it's not just prescription drugs. We should be focusing on, obviously, alcohol, marijuana, tobacco use. And it seems like they always come back around, you know, we'll focus on one thing at this time, but then, you know, the other things start creeping up forward. So it's always good to focus on a wide range of substance abuse. So right now, there's a lot of prevention education programs, you know, Too Good for Drugs, All Stars, Media Ready. There's parent prevention programs, Strengthening Families, Guiding Good Choices, merchant education around tobacco, retailers for alcohol sales, beverage service training, Safe Home, Red Ribbon Week is a good one. There's also alternative activities, Safe and Sober Prom, Project Graduation, summer camps for high-risk youth, community trainings, environmental scans, which is the retail environment, and there's also festival policy development going on. And then there's a lot of youth advocacy and then empowerment, such as Lead and Seed, SAD, and youth, Dover Youth to Youth. And I'll get a little bit into that later about some evidence-based practices that might be good for Parsons County that has been successful in other communities across North Carolina. So you might be like, well, these all sound great. How can we get funding to help support these programs within our community? So right now, there's Drug-Free Communities, DFC grant, which is available through SAMHSA. So the two things it helps do is establish and strengthen collaboration among communities, public and private nonprofit agencies, as well as federal, state, local, and tribal governments to support the efforts of community coalitions working to prevent and reduce substance among youth. And then also reduce substance among youth and over time reduce substance abuse among adults by addressing the factors in community that increase the risk of substance abuse and promoting the factors that minimize the risk of substance abuse. So the application is usually due March of every year and you can apply up to $125,000. Now this application is very competitive. I know, I think last year or the year before, I think 2 PFS counties that applied actually received the funding and they applied a couple times before they even were granted the award. So if you are interested in applying for this DFC grant, Melinda Pancott, who I work with, who I'm actually filling in for today, said that she would be happy to come help you guys and make sure you have the right things within your application. And she said she would be available to come later in the calendar year to help you. So if you want to start looking at that, you can go on the SAMHSA website and you can get all that information. And then I think also Parsons County is a block grantee, and I think Insight Human Services is your prevention provider, and there is a little bit of funding in that for prevention, so I would connect with them and they can maybe help spread some funds around to help provide some of these prevention initiatives within your community. So working with a lot of PFS and SPIF-RX communities, they're also very rural. So I want to give you some success stories that some of the communities have done with their funding. And in Burke County, I worked with them very closely. They had great partnerships within their community. You know, they're rural, they're small, tight-knit. So it was easy for them to reach out to the different sectors and make those partnerships with one another. And they developed a prescribing alert system, which was implemented in 38 of their practicing locations. They partnered with their overseeing hospital. I think it might be Blue Ridge out there. But this was to flag patients who were doctor shopping, and it was to help provide information to inform prescribing decisions and reduce controlled substances for their patient. So it was kind of to help the overprescribing issues that was happening out in Burke County. Cleveland County, they were also a PFS site I worked with. They have amazing partnership with their law enforcement. They were able to have 17 Dropbox locations. 17, that is like the most I've heard of in all the counties out in the state. So then it's not just that the law enforcement, they partnered and had MOUs and agreements with the local pharmacies out there too. So the law enforcement would come and pick up at the pharmacy locations. But they've worked very well, and if that's something you might be interested in, I can always connect you with them. They're very willing to help, and they love sharing how they got 17 Dropbox locations in their community. So Mitchell, I always pronounce this wrong, I apologize, Yancey County, Rockingham, and Robinson County, they have been very successful engaging their youth and youth advocacy and empowerment through the Lead and Seed program and the Youth to Youth initiative. Actually, Mitchell Yancey Coalition, they work together because they're just a very small out there in the mountains community. They were actually able to send a couple youth within their communities to the Youth to Youth initiative training camp this past summer. And at this training camp, they were able to teach the youth tools and skills to actually bring back, and they are going to go in their local high schools and kind of be, youth activists, sorry, and be like peers to their peers to help with substance abuse issues. So I can always connect you with any of these providers. They're willing to help and spread their stories and how they were very successful around these issues. So you might also be thinking, what are some evidence-based practices that might work for you guys? So every community is different. You want to make sure you do a needs assessment, you do strategic planning, you talk to all your members in your community. But Lead and Seed is a youth empowerment environmental approach to preventing and reducing alcohol consumption, teen tobacco use, drug use, and prescription misuse in the community. They're reviewed as evidence-based drug prevention program included in the National Registry of Evidence-Based Programming and Practices. And we actually have local trainers in North Carolina because I think 8 out of the 13 Partnership for Success communities did Lead and Seed, and they were actually very successful at it. And so that's something to be thinking of too when you want to think about what approaches you want to take in your community. And also the Youth to Youth, which is out of Dover, New Hampshire, and they were actually at that statewide conference in June, and they had a prevention track. They actually have youth come, and they are youth who are actually training your youth in your community. And then I highly recommend, if you haven't seen them, I would go and look on their website. They're awesome at what they do. They do a lot of policy changing in their community. And they also offer toolkits and resources off their website. Another one would be take-back events, prescriber trainings, or retail trainings, or fraudulent ID trainings. Those are very good. I did those in Maryland a lot, training restaurants, convenience stores, bars on proper identification of an ID that kind of helps, reduce underage drinking or underage buys. You can do a lot of policy work. I know Iredell County did a policy change within their hospital systems. I think it was about around prescribing. You can do a lot with tobacco and alcohol. I know in Maryland, I worked with the local liquor board, and we made a matrix. So every time that they got caught during a compliance check, they would have to they would pay a fee, and then they would be on probation. And if once you got 3 times within 3 years, you would lose your license. So that's something to work around too. I don't know if you want to work with like the ABC liquor board. Environmental checks, alcohol sales, compliancy checks, parent education, guiding good choices, really good. I did that in Maryland as well. And I know a lot of communities in North Carolina have been working with that. And if you want, there's tons of evidence-based programs and approaches. So you can go on blueprints.com or NREP, which is that National Registry of Evidence-Based Practices and Programs, and it will tell you the outcomes, the target population, the environmental setting, and what would be best for your community. And I also have something to share that at the state level we've been working on. I'm on this state epidemiology work group, and we've been working on an NC dashboard, which provides data for all 100 counties, and you can actually do comparison between different counties that are similar in demographic to yours. And I have a copy. It's not the best, but I have them up here if you would like. It's kind of a preview, and it shows you data, your population, where you're at on the state, your demographics. Right now I just did a copy of alcohol and other drugs related consequences. So you can see drug related death rate, you guys are at a higher risk, and smoking related death rates, you guys are at a higher risk on that. So this will help too, providing to see what focus areas you want to focus on within your community. So I have these, and this is a public resource. We did this for everyone to have access to data from the North Carolina. So that's going to be a great resource for everyone to look at and use. And if I can provide Ronnie with the site, and you can share it with everyone if you like. So what advice can I give you is to move forward. So I think working together as a whole is always great. You know, with everything going on, usually there's always been a group that's been working on it before, and then you say there's been a tragic accident within your community, and then someone's like, oh, we need to do this, and then they form their own coalition. It's better to work together and then see what you would want to develop forward. Opportunities to partner or work collaboratively with another group or another county or even another state is awesome. You know, you can build those partnerships and learn valuable information from one another and get resources. Don't bite off more than you can chew. It's usually a process that you have to go through. You know, it takes time. People always want to get things done right now, but you always have to do those step by step to make sure it's very successful. And don't be afraid to ask for help at the local, county, or state level. You know, we're here to help, and we want to provide you with the right resources and tools so you can be successful, and then it will help us also be successful across the state. So, do you guys have any questions for me? I know I kind of talked a little fast. No? No questions? You guys need more coffee?
I just want to remind everybody that there's a lockbox at the Law Enforcement Center, 24/7, right inside. And Sheriff Jones, do you want to say anything?
Do you want to go up to this microphone to see what you're able to hear?
Well, actually, Lock Your Meds also offers lock boxes too.
Right.
So if you need lock boxes, they'll provide them for you.
I do want you to look at the sign as you go out. It's right inside the door I put up, and it was a gift from the Lock Your Meds campaign.
Okay, awesome. And I'll give you those coordinators' names so you can get free resources.
Yeah,
So.
thank you.
We do have the lockbox at the Law Enforcement Center, and it's surprising to me that we take in a couple 100 pounds of pills every month. We do it one time a year, which is going to be October the 28th, is a drop day to where all you have to do is drive through the lot. Basically, if anybody's ever done our fundraiser for Relay, you drive through, drop off, you don't even have to get out of your car. And we have taken in as many as 40,000 pills in a 4-hour period here in this county. So anytime anybody has anything, of course it's just the pills and not the needles and stuff, but we'll take them and get rid of them properly.
I like those drive-through, take-back events.
Yeah.
Well, I just want to thank you guys.
Wait.
Okay, you have a question?
So we got some time left, but I just want to let everybody know that we do have a committee that is working in Person County, and we've been doing this for a little over a year now, and it's part of the Healthy Personians. If you remember correctly, last year about this time, we had a program on, on substance abuse because September is Substance Abuse Recovery Month. And since that meeting, we've had 15 to 20 people meet every month. Martha Pickett, Freedom House, chairs that committee. I guess you're wondering why I'm holding a napkin. I'll get to that. Shares that committee, but we are looking at the DFC site. Rick Farmer from PCC has been looking at the grant requirements. So some of this community coalition thing is already going on. And we are very healthy in that, and we're meeting together. And so if you have any interest in being a part of that, or you have any thing that you want us to be focusing on, if you will either find me or Martha or Antoinetta or Carlton, Leanne, somewhere. Oh, okay, so you guys decide to hide. Okay. But I also want to introduce Mike Beckett. He's here. He is the Assistant Secretary for the Department of Health and Human Services, and he was able to come over this morning. I think he's fairly new on the job? Yep. Okay.
Good morning, everybody. My name is Michael Beckett. I'm the Assistant Secretary for Human Services, where I actually oversee the Division of Aging and Adult Services as well as the Division of Social Services. And I am pleased to come and be here in Person County today, invited by Carlton Paley, your Director of Social Services. And it's hard for me to be in a room and not to sort of come and say hello, bring greetings from the Secretary. As you all may know, or not, Secretary Mandy Cohen is a physician who is very, very concerned and very interested in the opioid epidemic. There's a lot of change happening at the Department of Health and Human Services. There are, I'd like to say there are two sort of very big projects that we're undertaking. One is Medicaid transformation. And that's important to this opioid epidemic because what we're trying to do through Medicaid transformation is to blend sort of understanding the social determinants of health with and integrating that into primary care along with behavioral health. Because one of the things that we recognize that in order to really provide sort of effective sort of medical care, to sort of work towards creating health for people, not just giving health care, is that we really do need to bring together sort of health, mental health, as well as sort of social services. I like to think that social services in Carlton, I think you'll agree with this, we're never at the wrong table. Because social services, we provide services to people, and I say it from cradle to grave, literally from birth to really helping pay for burials. And many people don't necessarily know sort of the depth and the breadth of the services that we offer. But when it comes to, and I'm going to try to stay specific to the topic that I think we're here to talk about is sort of the impact of opioids on our communities. We even have to take and pay attention to what's going on with parents who are giving birth to sort of children who may be affected by substances. And so my office, in response to a federal requirement, not long after I got here, established a policy on something called the Plan of Safe Care that really speaks to working with families where there's known opioid use and working with parents at a prenatal, before delivery, and at the point of of having delivered the child, to understand sort of safe storage of medication. Secretary Cohen always talks about we all have a story. Everybody who comes into sort of public services, especially around human services, and that nurses and doctors, police and sheriff deputies, we all have stories about the things that we've seen. And I've seen where a kid who's a toddler sort of picks out medicine and eats it and overdoses. And these are the types of things that we need to avoid. We need to be paying attention to in a very, very broad way. When I think about sort of what's happening with the opioid epidemic now, I can't help but think about my own youth and remembering what was happening around the crack epidemic. And there was a lot of effort and energy, not probably as fast as I think it probably should have been back then, paying attention to sort of families affected by sort of crack. But we are also sort of faced with a very similar circumstance that seems to be rapidly moving through our communities. And some of our communities are seeing this much more rapidly, much more significantly than others. And if you're 18th on the list of sort of opioid prescriptions, the number of pills in your community, there are sort of strategies and policies that the Secretary is sort of taking up, like limiting the number of prescriptions, that number of pills that are allowable under prescription, sort of when a person is insured through Medicaid. And while some of these things take legislative action and a lot of agreement, our goal is to reduce the opportunity for people to have access to these pills. So while we're focused on social services, sort of cradle to grave, we talk about the plan and safe care for infants, but on the other side, we also have to worry about sort of the pills that we all have in our closets, in our medicine cabinets, and what's going on with youth. Think about sort of the elderly people who we take care of, or are getting sort of pills from their doctors, and they're being stolen by caregivers, by young people. And then we have to have a strategy to sort of understand that and educate people about the impact of these medicines sort of on the people in our community. And so while I can't sit in the back of a room and sort of sit idly by and not sort of say hello, I do want to give sort of a higher level picture that this is important to sort of the Secretary, it's important to all of us. I tell you, as a social worker, I never thought I'd sit in more meetings about medicine in my entire life. But since I've been in North Carolina, I have been in more meetings about healthcare and improving the health of people in North Carolina than I have ever in my entire career. And I'm more than happy to take some questions or any thoughts that you'd like me to take back to the Secretary. And I'll be here probably until about 9:15 if anyone would like to sort of have a chat with me on the side. But thank you for the time and opportunity.
Thank you.
Just two notes. As the supply of prescriptions dry up, because docs are prescribing less and we hopefully are getting the medicine cabinets clean, what's happening is that our addicts are turning to the street for substitutes, heroin, and often getting into things that they don't really know how it was put together. The last thing, and I appreciate Mr. Powell bringing this locally. Just a few days ago, I stopped at a stoplight and watched a police cruiser lead a funeral procession through our town, and I knew who it was. Obituaries don't say so-and-so passed away today from drug-related illness, but I knew. And the reason I knew is because this was a young woman that I had worked with in the past, unsuccessfully worked with in the past. So we know, you know, and we know that locally we are experiencing this. We know that we are experiencing deaths by our citizens because of this issue. And I don't want to be too much of an alarmist, but I sort of do. I don't think we can watch the bodies float down the river anymore and just say that's sad. I think we need to say we're not going to tolerate this. And some of the initiatives that Ms. Woods talked about are things that we are going to work on. So if you want to be a part of this initiative, or if you have input about this initiative, please find me or Martha or Carlton or Antoinetta or Leanne. Yes, sir, Mr. Jeffries.
Ronnie, I wanted to also mention, Chairman of the DSS Board, I wanted so many of you all here to be aware of or inspire you at least to, when you go back to your church or to your community organization that so many of us are involved in. We have over 80 children in foster or in our custody at DSS. Over half of those children are birth to 5 years old. About 70%, a little bit more of those children are there because of their caregivers or substance abuse, or either they have some type of substance found in their system that they had to come into our custody. We do not have enough foster care homes here in Berkeley County, so if you are interested, please go by DSS and apply to be a foster home. If you can't do that, you want to just be involved somehow, please get involved in donating. You know, Christmas and things like that are coming up. But it is a serious problem, not only for our adults here in Person County, but it's now affecting our children. And I say our children because they are Person County children. So any way that you can get involved, please see our DSS. And I'd like to thank our staff, not only DSS, but the health department and so many of our partner agencies like yourself, Ryan, for getting involved.
Thank you, Mr. Jeffers. It is a mistake, by the way, to tell me there's still time left on the program and give me a microphone. So I'll let you, for future reference, you don't do that. But I do want, if there are any questions or comments that anybody has, otherwise, yes, ma'am.
I just wanted to give a little advice. I work in social services, and a lot of our clients don't know about what's out there. They just don't know what's out there, and if you can make it a little more known to the public and to the clients and to everyone, because I didn't know that since our last substance abuse community program, that there was a program. So if you could just make it more known.
Thank you so much for that, and we are trying to do that. The Healthy Personnians did develop a brochure to put in places where we felt like that addicts would be would find them, but we are firmly aware that we don't have our message together yet, and we also have talked about with other groups that making providers and people in need aware of the services of the county is something we need to do, and we are working on that. And anytime you feel like we're not working hard enough, you stand up in public and tell us. Thank you for that. Otherwise, if you don't have any questions to comment, I'm going to just give this. At 12 o'clock at the Kirby, there's a luncheon that the community is invited to. There's a limited amount of food, so you should probably get it early. But Michael Cannon and his wife Barbara are speaking. And for those of you who were at the opioid conference in June, I'll just give you a little bit. He is a real estate agent in Wilson, and he buried his son. And he announced on social media and through the street that nobody would be allowed to wear a tie and a suit and a coat to his son's funeral, that he encouraged everybody to come as they are, because he knew a lot of his son's acquaintances would not have a coat or a tie or a suit. And at the funeral, he stood up and gave his home address, his home phone number, and his cell number, and made the announcement that anybody who needed help should come see him. And his wife says that she was cringing as he did that. And at 8 o'clock the night after he buried his son, the doorbell rang, and there are 3 disheveled people standing at the door saying, I need some help. And so he has a story to tell, and hopefully this sponsors a discussion at the luncheon about ways that our community can respond, so you're invited.
Thank you, Ryan. Certainly heard some mind-boggling and startling facts today, but I'm glad there's help out there between you guys and DSS. I want to thank everybody for coming out today to Good Morning Coffee Hour. It was sponsored by Roots and Wings, Department of Social Services, and Healthy Personnians. Our next coffee hour will be Wednesday, October 18th, and will be hosted by the Person County Parks and Recreation. Thank you for coming. That concludes today's program. Time to go back to work.